types of insulin that requires us to mix it. So instead of giving our patient 2 shots, there in some cases we can mix that insulin and give that patient only 1 injection. And that doesn't seem like much, but sometimes if you've got a patient that may have to have 10 shots a day, then just having to give them 5 injections would be a lot more comforting to them. Before you mix insulins or before you give insulin, you always need to check your doctor's order. And you always, first you need to see, can those insulins be mixed? Not all insulins are created equal. For example, the Lantus breaks all the insulin rules, and Lantus can be mixed with nothing. So it has to be by itself. But let's say your patient has got what's called NPH and a dose for regular insulin, then you can mix those 2 together. So the normal rule we talk about is mixing clear and cloudy. For the most part, clear insulins, and that means when you look at them, they are clear, there's no sediment, they look like water. Clear insulins are essentially, most of the time, fast acting. That means that they are going to take effect within usually 15 to 30 minutes. Some have an onset of like 5 minutes, and you have to be sure that the food is in the room when you give it. So when you do your insulin cards, that's something you need to add. You need to add the onset time and the peak, meaning how quick is it going to act and when is it going to reach its highest level of performance. So for the most part, clear insulins are fast. Cloudy insulins, which is just like what it says, cloudy like this NPH, it is milky and cloudy, and it's supposed to be that way. Cloudy insulins are essentially long-acting, meaning that they may have a peak time of 8 to 12 hours, and maybe that patient only has to have 2 or even 1 shot a day, injection a day of that cloudy insulin. Again, Lantus breaks all the rules. Lantus is long-acting, but it is fast. Lantus is also one that is not good for 30 days when you open it. It is only good for 28 days. Then it has to be discarded. So we're going to mix our insulins. So our patient is on NPH and they are on a regular insulin. And for the sake of easy math, we are going to do 20 units of each. They need 20 units. Well, we can't do that because, again, that's something you would question. Nobody would ever get 20 units of regular insulin. That is too much. So if I saw that, I would really have to clarify it with my physician. So let's say that our patient is going to get, we will do, let me write it in green so we can see, 40 units of, you always write out units now, of NPH, or the N insulin. And we're going to do 8 units of the regular. So that's going to be a total of 48 units that's going to end up in our syringe. So initially, we've checked our insulin, we've checked our order, I have checked my expiration dates to be sure that they have are in the safe range to use. I've got them out. I've got to also pick the correct syringe. There are 2 types of insulin syringes. And by the way, you only give insulin in an insulin syringe. Insulin syringes, the ones I've ever seen, have got orange caps on them, and you only give insulin in insulin syringes. You do not give it in a TB syringe or another syringe. It has to be an insulin syringe. And as you can see, this one you can put 100 units in it, and this one goes to 50 units. So if I'm giving someone a small dose, maybe 4 units, I may choose this one. And I'm giving 48 units, so I could technically still use this. But since this one's a little bit bigger, I think I'm going to use this one to do. Insulin needles come already with the needle attached. It's usually a very small gauge, probably a 25 gauge, and it's usually a 1/2 to 5/8 of an inch standard. So I'm going to use this syringe. Now, if my patient, when I did the math, if they came out that they needed 60 units, of course I couldn't use this syringe. It's not big enough. So I'm going to use this one. So we have to balance out the air. And no matter the type of, the insulin always comes in a vial, and usually a multi-dose vial. Like this one is got, usually have about 50 cc's in them. And insulin normally comes in a strength of U100, meaning there's 100 units per ml. That's not the dose, that is the strength. Our dose is going to be 40 units of the N and 8 units of the R. So I'm going to clean the tops of my vials. I'm going to scrub the hub for 15 seconds on both of them. I've washed my hands before I've started, by the way. So I've done my hand hygiene. You do not have to wear gloves with preparing this unless there's something in your agency protocol that tells you to. But I've done my hand hygiene and I've scrubbed the hub on my 2 vials. So we don't, every time we put our needle through the top of this, or the diaphragm, the stopper on this, it's going to dull our needle a little bit. So we want to actually pierce the tops of these as few times as possible. So again, I've got my NPH, my long-acting, my R is my regular. That one's cloudy, so you always roll it between your hands. You don't shake it, you roll it between your hands until you see that that is all dissolved. Usually doesn't take much, so I'm gonna roll it. Okay, now, which one do I put air in first? Because when I'm doing this, I want to be sure that I'm not mixing the insulin in these bottles. I want to be sure that they're in the syringe. So I'm going to put the air in my cloudy one first. So my cloudy, my NPH gets 40 units. So I'm going to draw back. And when you use a syringe, you do not want to touch the barrel or the inside of that. You want to touch just the tip. So I'm going to find 40 units of air here. And I'm going to put it in my cloudy first. I'm going to turn it up. I'm going to check it. That is my N, that is my cloudy. And I'm going to go in at a 90-degree angle. And then I want to inject my air into air. You don't want to put air into the liquid or it's going to make it bubble and it's going to make it hard for you to get your bubbles out of your syringe. And I'm going to take my needle out. So now I'm going to put my air into my clear, which is 8 units. So I'm going to find 8 units of my air, 8 units of my air, and I'm going to put my air in. Now, while my needle is still in here, I have to draw up my clear. So I'm going to invert my bottle. You have to work with this with your hand dexterity, because these needles are very flimsy. If you're not careful, you will bend the needle off of these syringes. And I'm being sure that my needle is in my liquid medication, and I'm going to draw back slowly, trying to not get any air in. I'm going to draw back. I'm going to draw back a little past the 8 so that I can get my air up to the top of my syringe, and then I'm going to push it back in because I had an air bubble in it. I'm going to draw back and I'm going to get my 8. So I'm at the 10 and I'm going to push it up to the 8. It's hard to tell, but I've got 8. My order says 8. I've got 8 of the regular. Now, I have to draw up 40 of the cloudy without injecting any of this fast acting into this bottle. Because if I inject any of this into this bottle, I have to trash this whole bottle. And bottles of insulin can be up to $200 a piece. So you do not want to do that. So I've got my N. I'm going to draw it. I've got to have 40 units. So on my syringe, it's going to come up to 48. So I've got to realize where I'm at with my 48. I'm going to put my needle in. I'm going to invert it. And I'm going to slowly pull back to my 48. So I see my 40. And I'm at 48. It's hard to tell. I don't know if you can see it there. Can you see it there, Sydney? I'm at my 48. Then I can take this off. So I've got my N, I've got 40. Now if I was doing this, if I was mixing insulin, I would have another nurse with me, because insulin always has got to have a second nurse to verify what's in this syringe before you get it. I don't care how busy you are. I don't care how short-staffed the floor is. 2 nurses has to verify the medication and the dose before you can give insulin. Now, this is not a safety syringe, so I can't, this is an old syringe. And this is what your patients use at home. But now in the facilities, the syringes come with a safety device that you would push back up over this needle, because you never recap a needle, because you could accidentally stick yourself. So I'm going to have, for the sake of me going to the patient's room and I do not have a safety device, I am going to have to use my one-handed scoop method, which is still not best practice. Best practice is not to recap a needle. You use your safety device. So I'm going to hold it down, and I'm going to, boy, I did a crappy job at that, because you can't touch the needle to anything. I'm going to scoop it. Now I'm going to give it to my patient. So I've done my AWOPs, I've checked everything, I have checked my patient's blood sugar. This is a lot of insulin. 40 units of NPH insulin and 8 units of regular insulin. That 8 units of regular insulin is quite a bit. So you want to be sure that your patient's blood sugar is good. Usually facilities have got sliding scales, and we'll go over that in another video to see when you would give this much. So we'll say the patient's blood sugar was 220. Now that's a safe blood sugar to give this. But if my patient's blood sugar was 120, I would not give this much insulin. That's too much regular insulin for someone. So that's something that you have to know as a nurse. The doctor may have this ordered, but if you assess your patient and you check their blood sugar finger stick and their blood sugar is too low, then you as a nurse would have to know, hey, this isn't safe to give. I need to let my charge nurse know and the physicians know. So I've got my insulin drawn up. Now I'm going to go to the patient's room, and I'm just going to do it here at the bedside on my cart to show you. And I'm going to put me on some gloves. You always give injections with your gloves on. And my gloves are over there, so. And my medication is still in my side. You don't ever want to walk off and leave medication in your cart. I'm sure a lot of you have seen nurses give an insulin injection without gloves on. You always wear gloves when you're giving injections. So I've done hand hygiene, and I'm putting my gloves on. And when you practice giving injections, put your gloves on, because you need to know how it feels different. And so you need to be sure that you're practicing with your gloves on. So I've got my patient, and mind you, this is a stocking with rice in it that I've made for practice. But on your patient, remember, you're going to give it sub-Q, so you're going to need to pinch up some fat, and this allows me to show you how to pinch it up. Plus the rice bags, it will soak up and it won't be a problem. I've had another nurse verify with me. Sydney, did you verify with me? Yep, she verified. I've identified my patient. I have made sure that their blood sugar is good. They're getting 8 units of regular insulin, and they're passing lunch trays now, so lunch should be in here in a few minutes. The patient isn't vomiting. She's feeling good, so there's no reason why that she cannot get this dose of insulin. So I'm going to pretend that this is their abdomen. I know it's not laying on my, it's laying on my med cart, but for the sake for you to see it, I'm going to lay it up here. I'm going to open my alcohol, and I'm going to do in a circular motion. Now for me, once I clean an area, sometimes when you let it dry or you turn your head to it, you forget where it was because it dries and you can't see. I always lay my alcohol pad with the point to it, kind of pointing. It says, hey D-Berry, right there's where you cleaned it. You should give it right there. And once you clean, again, did you see me doing a circular motion? You got to put a little, because your purpose is cleaning, you just don't want to barely do it. You've got to really kind of bear down and clean that skin. Circular motion inside to out. I've laid my alcohol pad there to remind me where it is. And you don't do this. And you don't do that because that's contaminating your area. So you let it air dry. Take your cap off or deactivate your safety. Then, let me get over here. You're going to have to pinch up the area. On IM injections, remember, you got to push it tight. On a sub-Q, even if your patient is 400 pounds, you still want to pinch up that area. So I'm going to pinch up my area. I've got my needle. My needle still looks good. And I'm either going to go, because this, I've got a good pinch of fat here. I could go in at a 90-degree angle, straight up and down, or I could go in at a 45 degree. So I'm gonna go in at 90 degrees. So I've got my area pinched up. 1, 2, 3. I'm gonna go in. I'm gonna let it set just a second. I'm going to give my medication. I'm gonna let it set just a second. Then I'm gonna pull out. Then I'm going to apply slight pressure. Then I'm gonna put my safety device on my needle, which this one doesn't have. So I would need to directly walk it over, point down to my sharp spots. Then that's how you give a sub-Q injection. Now, if that was a heparin injection, notice how I kind of put a little pressure and rubbed it a little bit. That is something you never do with a heparin injection or a Lovenox injection that is for blood thinning. You never massage. You can kind of just lightly tap it, but you cannot massage the area afterwards or it will cause a huge bruise on your patient's abdomen. So that is our sub-Q injection. That is mixing our insulin, hand hygiene. Remove my gloves, hand hygiene. Remember, air in the cloudy first, then you put your air in the clear. With the needle still in, you draw the clear, needle out, put it back into the cloudy, draw your cloudy. 2 nurses, always check it. For the most part, your clear insulins are fast. Your cloudy insulins are more long acting. And then Lantus is the hybrid. Lantus, it is clear, but it's fast, and it only lasts 28 days, and you cannot mix it with anything. It has to go in a syringe by itself. And you always check the date on it, and you always roll the cloudy between your hands. And that is giving her insulin.